Coronavirus, or as doctors and scientists call it, COVID-19, has impacted countless lives since mid-March 2020. Most schools, businesses, and communities quickly changed how they operated to prevent the spread of the virus. Because the disease infected a large number of people all over the world, experts call this a pandemic. It is easy to feel overwhelmed and nervous when thinking about COVID-19. Here are answers to some questions you might still have about coronavirus.
In terms of the spread and stuff, how is it spread and what is community spread? I could take it back to you, Dr. Moses.
Yeah, so how it spread is it's spread. In the beginning, when we didn't know much about it, there were a lot of different theories about like touching. But what we have found out over like the last couple of months is that the greatest route of spread is through respiratory droplets. So you cough, and you produce like saliva droplets, or you sneeze and you produce saliva droplets, and that goes to like another person. That is like the main way that COVID is like transmitted.
All right, thanks. What should I do if I become infected with COVID-19 at home, or someone in my house becomes infected with COVID-19?
I think as the previous Dr. Belfon has been pointing out, the absolute safest thing to do if you have the space is to get that person within a room for themselves and to allow them to have a confined space where they can eat and not share a bathroom, not a toilet or anything else, utensils, whatever the case you may have.
Sorry, I just want to bring in the public health perspective on this too. I get people's perspective that, if I boost my immune system, if I'm healthy, I'm good. But I just want us to remember that this is a virus that is spread to other people, right? And if we think, data may suggest otherwise, that, you'll boost your immune system to a point where if you are exposed to COVID, you would not get infected. That would not happen with everyone, right? Many of us, or I would say I think people should get vaccinated, and that we need to focus on other mitigation efforts is because there are people who, no matter if they steam from here to tomorrow, or if they try any of those things, they're not going to boost their immune system to a point where if they do have COVID, that they are going to A, survive, or B, prevent really serious illness.
Continue to stay safe. Follow the COVID-19 protocols and be sure to take very good care of yourself and loved ones. For this week's GBN Health Update, I am Krista Campbell reporting.